Welcome to today's video. We're covering chest drain insertion, a key life-saving medical procedure. Let's get started. Basics of pleural space. The healthy pleural space contains 30 to 50 milliliters of fluid and no air, maintaining negative pressure. Excess fluid or air can impair breathing and must be removed. Indications. Chest drains are indicated in conditions like pleural effusion, pneumothorax, hemothorax, chylothorax, pyothorax, and early empyema. Consent. Always explain the procedure, benefits, and possible risks to the patient, including bleeding, infection, and pain. Preparation. Correct any bleeding disorders, maintain strict asepsis, use local anesthesia with lignocaine, and ensure good lighting and prepared equipment. Positioning, place the patient supine with the head elevated 30 to 40 degrees. Insert the drain in the fourth or fifth intercostal space, mid axillary line. In emergencies, use the second intercostal space, mid clavicular line. Procedure. Sterilize the chest wall. Identify the correct site and infiltrate it with local anesthetic. Aspirate to confirm the presence of air or fluid, then make a small horizontal incision. Use blunt dissection to reach the pleura. Insert the finger to clear adhesions. Guide the drain carefully into the pleural space and connect it to the drainage system. Post-procedure care. After insertion, take a chest X-ray to check the drain position, lung re-expansion, and rule out complications. Complications. Bleeding. Minor bleeding is managed conservatively. Major bleeding requires surgical intervention like thoracotomy. Complications. Infection. If infection occurs, remove the drain, obtain a wound swab, start antibiotics, and insert a new drain if necessary. Complications. Pain. Pain from intercostal nerve irritation may need intercostal blocks. Shoulder tip pain often improves by disconnecting suction or slightly withdrawing the drain. Complications. Migration. Never push a slipped drain back in. Remove it completely and insert a new drain at a different site. Complications. Surgical emphysema. A chest X-ray will confirm surgical emphysema. Correct by inserting a new drain and sealing the insertion site. Complications. Lung and organ injury. Severe lung injuries may require thoracotomy. Rare injuries to organs like the liver, spleen, or heart need emergency surgery. Thank you for watching. Don't forget to like, share, and subscribe for more medical learning videos. See you next time.